What's going on, guys? Welcome back to my channel. In this video, I'll be going through PowerPoints that sort of documents how to prepare for your finals, whether you're in, third year, fourth year, or final year of medical school. Even if you're in your preclinical years, hopefully this will be useful to you. And of course, I'll be showing how you can use it, how you can succeed using Dr. Prepper as well. So let's start from scratch. So study for finals, okay? Let's get into the slideshow. Okay, so, why should you have a framework for studying for finals or in medical school? I think because in medical school, there's a lot to study, there's a lot to go through, and by having a sort of idea or plan as to how you want to study or how you want to structure your time, I think it makes life a lot easier. Okay, so let's go into like the first thing. So why do people finish pass med and still fail their mocks? I used to have loads of friends in medical school. Like I was a pass med merchant. I had a lot of friends that were pass med merchants. Sorry if you heard something there. I was just trying to fix my mic. But pass med is definitely a very, very good resource and tool to use. And yes, don't just rely on pass med to be a good doctor. But of course, you still need to pass your exams at the end of the day. So you still need to pass the, SBA portion to show that you still have the knowledge to become a doctor. Of course, there's a lot more that it takes to be a doctor than just having like the knowledge side of things. So why can you finish pass med and still do mocks? I've done 3,000 questions, but I still freeze on the wards. You need to be out there. You need to be going to placements and making up placements what you want. So even if you do leave early, I left early. Some days I didn't go in, but if I was there and if I was on the ward and if there was a doctor or member of staff that was willing to teach, I definitely made a point to stay and to gain as much information as long as somebody was there to teach me, be it from 9 to 12 or for the full day of placements. So every method has a version of this, but the issue here isn't effort. It's like what the effort is training. You can't just be bunking placements and bunking like OSCE like practice or bunking seeing real life patients, because at the end of the day, not only for exams, but this is something that you'll hopefully be doing for the rest of your life and doing in your day-to-day job as a doctor. So it's important that you do what you can to come on the wards and to try and learn as much as you can. Okay, so what do finals actually test? So we have like a case presentation. So let's say like an OSCE or an SBA question. It starts with a case. Then your differential, what could it be? Investigations, how do you confirm it? And management, what do you do next? So these are sort of how like you're tested in terms of like UKMLA, which is the SBAs and OSCE stations. So all of them sort of test this like sequence here, and and active recall or going through Anki's and questions to know these conditions and to know the common presentations of these conditions are very, very important, when you're studying. But this is sort of how finals normally work. Whatever the case may be. So why am I saying this? So what does this mean? So 3 things that every med student does. So we have, of course, SBA questions, pass med, quest med, pass test, flashcards and notes to actually understand and to go through the information, be it using Anki, using mind maps. I had friends that never used pass med or did like 1,000 questions max, but they had solid mind maps. They made diagrams, they made flashcards. They did what they needed to do to study and to pass their examinations. And of course we have placements, which is ward rounds, going to clinics, going to on calls as well. Maybe even if you have time in final year, attend some on calls with some final years. Attend some on calls with some F1s or F2s and just really see what the day-to-day job is, assess patients yourself, help out with jobs. I think this is a very good way for you guys to learn and to really be involved. And what does SBAs train it today? They train pattern recognition, which is important. A lot of people don't like it, but a lot of the job is picking up trying to see what patterns come up, and be it for like chest pain. If someone comes in with like with an MI, they have like a pressure squeezing chest pain that radiates on the left side to down their arm, up their neck. They may have breathlessness. They'll be clammy as well. They may, in severe cases, may have increased work of breathing and have a high oxygen and demand. These are things that are still vital to know and make your day-to-day job easier. Of course, you still need to be able to think from first principles, but I think this is where it all starts. Then you can go into doing flashcards and notes as well, which allows you to recall what you've learned. Going through these questions frequently, testing yourself, allowing time to forget, and then retesting yourself is active recall. And on placements, it tests intuition. So, no system, seeing fresh patients, seeing how the job actually works in real life, applying all the knowledge that you've learned from your SBAs, from your pattern recognition and your recall to real life and practice as a clinician. So, clinical reasoning is a trainable skill. 10 to 50% of clinical encounters are mostly from reasoning, not so much like your knowledge. So even though you do need to learn patterns, a lot of it does come down to you actually having to think for yourself as a doctor. And when you think in patterns, of course, it's fast, it's automatic, it's built by volume of exposure, frequently doing questions of pattern, frequently doing Anki flashcards. This is what SBA trains. But you need to also be able to work through, your differentials, even for conditions where you aren't too sure what's going on, or, the symptoms are very non-specific. So you need to have the analytical reasoning, to be slow, to be deliberate, to walk through your differentials, your investigations, your management. And I thought that this was what was missing in training. And also at the bottom of these slides, you see the references for all of the information that I'm listing here as well, if that's something that you're into. So the first piece of evidence is that testing beats rereading. Of course, we all know this. We've all watched Ali Abdal. We've watched Karma Medic. We know about active recall and spaced repetition for studying for medical school exams. And here's the stat here. At 1 week, students who tested themselves remembered 50% more material than those who just reread. Testing yourself using flashcards, doing questions, allowing yourself some time and to forget, do a question, then do it in 15 minutes, then do it in 5 hours, and do it in 1 day, then do it in 3 days. It pushes the information into your long-term memory. And I feel like this is vital for medical school. During my time there, I was doing, flashcards, I was doing questions every single day. Even if it wasn't a lot every single day. But me personally, that's how I studied. And I felt that it allowed a lot of time for me to push all of this knowledge and information that I'm learning, into my long-term memory. So when it came to exams, I didn't really have to cram because I had been studying the whole year, which made life easier. So evidence 2, spaced beats cram. So the forgetting curve is real. Within 24 hours, you lose 50 to 70% of new material. But if you revisit the information at different, intervals, 1 day, 3 days, 7 days, as we see here with no review, and we see here with review, we see that your retention over time increases. So this is what we were saying earlier. Evidence 3, cases train a doctor, not the quiz taker. So apart from those doing SBAs, Dr. Pepper isn't just something that you use to go through patterns. It's something that you use to actually take the information that you've gained from your SBAs, from your Ankis, from your flashcards, the real life information that you've learned from placements, from doing and different jobs and clinical skills and OSCEs, and to merge them together and to bang through cases where you're constantly forcing yourself to think for yourself, to think through 3 differentials, to think through relevant investigations and relevant plan, acute, intermediate, and long term. And this is just evidence to explain that, there's a 24% higher long-term retention with case-based versus didactic learning, 2.3 times higher improvement in diagnostic accuracy after deliberate reflection, and there's a higher transfer of knowledge to novel clinical scenarios if you're going through training with cases as opposed to training, just with SBAs and with standard practice and with patterns. This forces you to think like a proper doctor. So Dr. Pepper, that's why I've made this website. It's a case-based revision tool, which I think was missing in the middle of all these things. So it's one platform that allows you, that operationalizes the evidence above. So, retrieval, spacing, and case-based learning, all of them together, so you can practice and be a nice bridge between the standard traditional method of studying, which is, like SBAs and, Anki flashcards, and the more in-person training with OSCE practice with friends or placements. So it's a structured case library, and each case walks you through the presentation, the differential, the investigations, the management, allows you to reason out loud or in your head. You can work on this while you're on the tube. And it's mainly aimed at UK medical students, but it can also be done if you're outside like the UK. But I've built it based off of UKMLA and NICE guidelines. Okay, so inside one case, you'd read a case, for example, a 60-year-old that's coming with sudden anterior and chest pain that radiates to his back. Then you get some key signs on his examination and some key signs on his on his OBS. Then you'd move on to the differential. So what is your top three? Then what sort of tests or investigations would you like to need to help you to either confirm your top choice or to sort of defer between the three choices that you've put down? Then you can decide on your management. What is the plan? What do you want to do going forward? So the way I would do this, how I would use Dr. Prepper, is to make it a daily habit. There's over 500 cases there. And as well as, you do a lot of questions on past med and doing OSCE practice with friends. I'm not expecting you guys to go through all of them. But, as you're studying, when you feel like you have a good grasp of a condition, maybe you're going through endocrine and you feel like you're ready to go and start testing like yourself, as well as seeing it on placement and seeing it like with friends and family. Like doing Aki flashcards or do practice or exams, like let's say a thyroid exam on like your friends or on your family when you're home. You can also go on Dr. Prepper and actually work on seeing how that case would present in day-to-day practice, work on what the other like differentials there would be and what other key investigations and management plan would be necessary for like that case, which I think is very, very helpful, very, very valuable. Even like a case or two a day, I feel like it really, really would help you guys. So in terms of your weekly block, what this would involve would be, let's say like you're doing a new case, you're doing a new system, you're doing RESP. So you start with that new condition or list of conditions. Maybe you're doing bronchiectasis, you're doing pneumonia, you're going through your curb scores, you're going through, how these different conditions would like present. And then from there, once you have that, you can then, work through, studying the condition. So be it past med, be it on Anki, be it these different things, and then go from there to practice it with your friends, and then also practice it on Dr. Prepper as well. So you can actually see how this case would present and what the key differentials would be. So you already know what the patterns would be for key conditions from doing past med and from doing quest med. You know what to do for your examination, for doing OSCE, and for being on placements and for being on ward rounds and going to clinics. So now you merge those two together, practice it on Dr. Prepper, then go back again and consolidate that knowledge, doing the SBAs, doing the questions, doing OSCE placements, with your friends or while you're in university. Okay. So one system per week, same concept on 3 different formats. It forces your brain to form different synapses and, hopefully push the information into your long-term working memory. So it's quick and easy for you to recall, when you have finals or when you actually are working as a doctor. So the final 6 weeks, a lot of you have exams now coming up in June. So I would say, do 2 or 3 cases per day across every system and flag your weak ones, which you can do on Dr. Prepper. It tracks all of your progress. Then, go through the weaknesses as well. You can either go through them on Dr. Prepper. At the end of each case, there's some high yield information for you to study. But as well as this, you can also just go back to your more standard questions on past med and like your flashcards, you work on friends, mind maps, all these different things to like study. You don't just have to limit it to Dr. Prepper. As well as that, there's full mocks there as well as timed SBA papers, full OSCE circuits and daily cases for upkeep. So you do all of these, this is just your standard practice. You already have access to full mocks. You have past med, you have quest med, you have past tests. You can do all of those things yourself. This is just to bridge the gap and to force you to, to think intuitively, and so hopefully merge everything together so it's not just patterns, and you're going in and you're going on placements and you're learning how to think because you've been doing cases like yourself, and soon there you'll be finding placement easier. So pick your starting line. So build the stack into the current. So the habit that you need to be doing right now is 1 case per day, 1 case of Dr. Prepper per day. Okay, there's 365 days in a year. There's over 500 cases, one case a day. You don't have to finish all of it. If you want to do 2 or 3, you'll finish the bank by your exams if you're starting fresh. But in the lead up, assuming that you've been doing your past med, you've been doing your OSCE practice, you could probably move it up to 5 to 10 cases a day, 5 minutes each max, maybe 2 or 3 minutes, realistically at like this point. Then as well as that, if you have one system per fortnight, now this depends on where you are in your study and in your revision. You may even make it one system, like let's say cardio or rest every week or every few days, just depending on how far along you are with your revision. Then in terms of review, there'll be a weekly review, so a 30 minutes reflection. So let's say like you flagged up a lot of key conditions from your questions that you feel that you need to go over. Have a 30 minutes to 1 hour session a week where you just go through everything that you got wrong, be it all of the wrong questions are passed with a Quesmed, that they have nice functions there, then use that knowledge to then go and practice those cases again, or to do new cases on Dr. Prepper. And then from there, you can then go to do some OSCEs as well. So like you're hitting multiple different points to correct the things that you're getting wrong, and, which will hopefully allow you to do better in examinations. So the goal is to arrive at finals with 500 plus cases behind you of Dr. Prepper, plus all of the questions you've done on PassNet, plus all of the things that you've seen while you were on placements, so many different things. So this is if you're in year 1 to 3. If you're a finalist, if you're in 4th year even, I would say 3 to 5 cases a day, I think that you can do, especially time now from week 8. Then you rotate all sessions every 2 weeks, maybe even faster. Again, it depends on how far along you are. And you can review every 5 minutes, for example, what you got wrong and why you got that wrong. And then the goal for you is to pass, then mentor the year below you. But the goal for you is to smash it. I want you to smash your examinations, to do the best you can, and to hit F1 running and ready to do what it is that you need to be doing. So, this is Dr. Prepper, the Coders UK. I hope you guys can get on there. It's actually just Dr. Prepper. I hope you guys enjoyed this video. If you did, then please subscribe. Let me know what sorts of videos and content that you want me to see making. I make a lot of, I upload daily to Instagram and to TikTok, so go follow me there. Go and check out Dr. Prepper, the Coder UK. Honestly, I love this platform so much. I've spent so much time on it. I spent so much time making it. This is definitely something that I wish I had earlier in medical school, and it's something that I really think can help a lot of you guys to to hopefully exceed and to do what it says that you need to do. This is what it looks like. Here it is on the website here. So this is just me, a little word for me. Go there, read it yourself. Here's some reviews for some people. Here's the average score that I've been doing. I haven't been doing it properly. Okay, I can do much better than this. Here's the score you get. The case completion tracker. You can unlock all the specialties here if you want to upgrade. But if you just sign up now, there's 50 free cases that you can easily get involved in. Obviously, my account, this is my account now. So this is the pro account. So I have access to all of the cases I need here. We can go to obstetrics and gynecology, then click on it, and then you can just start going through the cases. You can read this case here. You type in your differential, you type in your investigations, your management, you score yourself after each one. Then you can reveal the plan that you need to be doing. Then you can also go back and then click, and then this is the high yield information to hopefully help you to answer and to know what to do, at the end of your OSCE stations. It's really aimed at that last 3 minutes of OSCE where you need to see your differentials, your investigations, and your managements. And the information listed here, it gives you more info to really break into the 80, 90, 100% for your OSCE cases, because it breaks things down from acute managements to intermediate to long term, which I feel is very, very necessary, very, very high yield for you guys to do what it is that you need to do to get those high marks. So yes, please check out Dr. Prepper. Let me know what you think. Follow, comment below. I'll see you guys next time.